A concerning wave of respiratory illness is currently sweeping across parts of China, overwhelming hospitals and igniting fears of a repeat of the health system strain experienced in past years. Videos circulating widely on social media platforms appear to show hospital corridors packed with patients, many wearing masks, while anxious parents stand in long lines at pediatric units holding children. These images have triggered growing public unease, especially in the absence of clear commentary or explanation from officials. Unverified reports have emerged suggesting that crematoriums and funeral homes are struggling to manage the sudden increase in demand. These developments, combined with a lack of detailed communication from authorities, have led some to draw comparisons to earlier health emergencies that left many communities vulnerable and uncertain. The dramatic visuals shared online show patients crowded into waiting areas and emergency rooms, as well as queues forming outside of medical facilities, especially in provinces like Hunan. While local media have cited a virus called human metapneumovirus as a possible culprit behind the latest outbreak, Chinese officials have yet to confirm this as the definitive cause. Human metapneumovirus is typically known to produce mild, cold-like symptoms and has been circulating for years. Nevertheless, in certain vulnerable populations, including children and older adults, it can result in more severe respiratory issues. Adding to the complexity, China experienced a similar situation during the winter of 2022 and 2023, when cases of mycoplasma pneumonia, also known as white lung, surged. That condition is usually mild, but the spike in cases at the time was attributed to children having reduced immunity after years of strict public health measures, including prolonged school closures. Experts suggested that limited exposure to common pathogens during those years may have left young people more susceptible to infections once regular activity resumed. According to the Chinese Center for Disease Control and Prevention, the current uptick in illness is largely due to a seasonal rise in influenza cases. Data from the CDC indicated that approximately 30% of diagnostic tests recently conducted returned positive results for influenza. Furthermore, 1 in every 7 individuals hospitalized with severe respiratory symptoms tested positive for the flu virus. Although these numbers align with annual seasonal trends to some extent, the scale of the current outbreak appears unusually intense in certain regions. In its most recent update covering the week leading up to December 29th, the CDC reported a significant increase in outpatient visits for flu-like symptoms. In northern provinces, about 7% of visits were attributed to such conditions, marking a 12% rise from the previous week. The numbers in southern provinces also climbed, with 5% of outpatient visits associated with flu-like illnesses, a 21% increase over the prior week. These statistics are notably higher than those recorded in the same period during previous years, particularly when compared to 2021. The situation has been amplified by the viral spread of videos appearing to show hospitals overwhelmed by the patient load. These videos surfaced online around New Year's Eve and have been widely viewed and shared. Among the footage are scenes allegedly captured in Hunan province, where individuals can be seen packed into medical facilities awaiting treatment. Although these accounts have not been officially confirmed, they have fueled public anxiety. One such report featured quotes from a local farmer named Mr. Peng, who described the situation in his region as severe, stating that many people had become ill and several community members had passed away. He noted that individuals of various age groups were affected, adding a somber tone to the growing concern. Additionally, a funeral director identified as Miss Wang reportedly shared that cremation facilities were experiencing an unprecedented surge in activity. She described long lines and the unusual decision to activate multiple high-capacity furnaces at once, producing dense smoke and continuous operation. She compared the crematorium's activity to a bustling marketplace during the festive season, reflecting just how overwhelmed the facility had become. In another anecdote, a popular Chinese video blogger known as Please Fei Jie recounted his personal experience of falling ill after attending an event in Guangzhou with his wife. Upon returning to their home province, both of them experienced high fevers, body aches, and headaches. The couple chose to isolate themselves from their children for several days to prevent further spread. He shared his discomfort online, comparing the experience to a previous illness he had endured, and urged his followers to wear masks in crowded spaces. This wave of illness closely follows last year's outbreak of what was referred to as mystery pneumonia among children in China. The recent wave of videos and images emerging from hospitals in China has caused a surge of anxiety around the world. Scenes showing packed hospital corridors, masked individuals waiting in long lines, and reports of overwhelmed crematoriums have led many to fear that another large-scale global event may be looming. The haunting familiarity of these visuals has triggered memories of the disruptions that once brought international travel to a halt and forced businesses across continents to shut their doors. Social media has played a major role in amplifying these concerns. As people share and reshare these images, theories and speculation have begun to spread, with many wondering whether another wave of widespread restrictions could be on the horizon. The uncertainty is compounded by the lack of immediate, detailed commentary from official sources, leaving space for assumptions to fill the void. Without clear explanations, fear tends to grow, and public anxiety intensifies. The thought of a future where daily life could again be disrupted is unsettling. For many, the emotional and economic toll of previous global health events is still fresh. People fear the possibility of renewed limitations on movement, school closures, and financial instability. As the world watches the situation unfold, the hope remains that lessons learned in the past will guide a more prepared and transparent response this time. At the time, videos also emerged showing large crowds flooding into hospitals in major cities like Beijing. Although authorities insisted the outbreak was not caused by a new virus, they acknowledged it was likely the result of a rebound in respiratory illnesses that had been suppressed during prior public health restrictions. Despite growing public concern and viral footage gaining attention internationally, the Chinese government and the World Health Organization have yet to formally address the situation in detail. The lack of official communication has only added to speculation and concern. However, the Chinese CDC has acknowledged the increasing rate of flu-like illnesses and continues to release weekly updates tracking the situation. Medical professionals in China are working tirelessly to manage the influx of patients, with reports indicating that both public and private hospitals are under strain. Pediatric departments appear to be particularly overwhelmed, as children are more vulnerable to complications from seasonal viruses. In some cities, additional temporary medical units have been set up to alleviate the pressure. As health services continue to respond to the crisis, calls for greater transparency and public guidance have grown louder. Many citizens are looking to officials for clear updates, protective recommendations, and assurances that the outbreak is being effectively managed. Some observers have pointed out that the lack of communication from authorities may be an effort to prevent panic, but others argue that openness and clarity are more effective in maintaining public trust. International health organizations are monitoring the situation closely. While the current data suggests a surge in known seasonal illnesses like influenza and potentially human metapneumovirus, the intensity of the outbreak and its impact on healthcare infrastructure is cause for concern. Scientists and public health experts agree that better understanding the factors contributing to the current rise, such as reduced immunity in the population and changes in virus behavior, is critical for planning an appropriate response. Ultimately, this mysterious outbreak highlights the fragile balance of public health systems during peak illness seasons and underscores the importance of early warning systems, data transparency, and global cooperation. Whether this is a case of multiple common viruses surging at once or something more unusual, what remains clear is the importance of clear communication, preparedness, and continued vigilance. For now, families in affected regions are being urged to follow hygiene precautions, seek medical help when needed, and avoid crowded places where respiratory viruses can easily spread. As hospitals continue to manage the patient load and experts work to identify the primary drivers of the outbreak, many are hoping that timely measures and improved communication will prevent a deeper health crisis. It's now been announced that officials in China have suspended chicken imports from Brazil following the detection of avian flu at a commercial poultry farm. This marks a significant shift in trade relations between the two nations, as Brazil has long been one of the largest suppliers of poultry to China. The decision reflects heightened concern over food safety protocols and the potential risks associated with highly pathogenic avian influenza, even as health experts reassure the public that the disease does not pose a direct risk through the consumption of poultry products. Brazil's Agriculture Ministry confirmed that the virus was identified at a breeding facility in Rio Grande do Sul, the country's southernmost state. In response, authorities have launched a full investigation in the surrounding area, covering a 10-kilometer radius around the affected farm. While Brazil has previously detected avian flu in wild bird populations, this marks the first time the virus has appeared on a commercial farm within the country. This development effectively ends Brazil's distinction as the last major poultry exporter unaffected by the global wave of avian flu outbreaks. China, which purchases a significant portion of Brazil's poultry exports, responded by imposing a 60-day suspension on imports. The decision underscores China's stringent approach to animal health regulations, which tends to be more comprehensive than the protocols observed in other countries. For example, nations like Japan and Saudi Arabia generally restrict imports only from specific regions impacted by an outbreak, rather than issuing a nationwide suspension. Brazil's Agriculture Minister Carlos Favaro expressed hope that the outbreak could be contained quickly enough for trade to resume before the 60-day period ends. He emphasized that officials are working diligently to mitigate the outbreak and safeguard the country's poultry industry. Brazil is a dominant player in the global poultry market, responsible for approximately 25% of worldwide exports. According to data from the Observatory of Economic Complexity, Brazil exported poultry worth over $9 billion in the year leading up to March, with China accounting for about 14% of that total.